today. We're going to hit on really what virtual care is and feels like and is today in terms of the dynamic of COVID-19, how Samson's been navigating his company, the opportunity, kind of the real life examples, the validation of the market. We're going to hit on regulatory alignment and the importance thereof when you're looking at products, solutions, and services, how important it is today. It's awfully complex. And then we're going to look at some, what we'd say, clinical application perspective, you know, of how virtual care is being used, the future of, and where it's going. So again, two great speakers. And from our HealthSnap side, I kind of, Samson, think about you as emergent, burgeoning health tech delivery for the very promising chronic disease management sector, and the virtual capability and the remote monitoring capability that you're offering. So I'm gonna have you do an introduction after Jamie. Jamie, when I think about Elevation Health, I think about a company that's sophisticated, that's assisting the greater HIT sector in navigating and prospering in very tumultuous times when it comes to policy, reimbursement, and again, regulation. So thank you. These are great dynamics to kind of converse over. Jamie, if you would, maybe just a backdrop on your company organization. We'll turn it over to Samson for the same, and then I'll introduce our first question. So Jamie, go ahead.
Yeah, hi, Rich. Thanks for having me, Samson. Excited to have this conversation. Elevation is a consulting firm that started a number of years ago out of the necessity to really work with health tech companies, really smart tech coming out of some great minds that we, as former regulators, a lot of us at Elevation are former regulators, we realize the need to kind of walk through what is going on in current and emerging regulations so that tech that's coming out of some of these really cool companies are really aligning to what is happening in terms of data exchange requirements, reimbursement requirements. We really want to see companies thrive, bringing these solutions to the forefront of the health market to really realize the health outcomes we all want to see.
Thank you, Jamie. Samson, how about your intro, please?
Yeah, thank you, Rich, for having myself and HealthSnap here today, and Jamie, looking forward to the discussion. As you mentioned, HealthSnap has actually been around for 5 years, and just to give a little background on the company, we are a University of Miami spinoff. So there's any Miami Hurricanes fans on the line, go Canes. But we started the company back in 2012 as a research initiative, and we're very fortunate to have an academic medical center backing us as we spun off and commercialized in 2015. And Rich, as you mentioned, we are a remote patient monitoring company focused on chronic condition management. So everything ranging from type 2 diabetes to obesity management to hypertension management, and looking to expand that in the near future as well. We work with large and small health systems around the United States, as well as physician groups. And the idea that we work with them on is how do you reach patients where they're at right now, which is their homes, and provide routine care to them, most importantly, in between physical in-person visits. And that's where we really fill a much needed gap right now, as in getting the appropriate data into the hands of clinicians to provide what we like to call always on and proactive patient care. And that's where we see a huge unmet opportunity when it comes to chronic condition management here in the US.
Hey, as you speak and exchange with each other, just our recognized audiences, providers in health systems. I see some investors on this list. I see some health tech consulting and some policy people. So as we explore kind of this relationship of health tech vendor and regulatory alignment advisor, let's be thinking about, you know, when we cater to their needs, you know, what we're communicating and best practices and lessons learned. Before we get into a real kind of a question, I want to set a little bit of a bar on where we were 12 months ago pre-COVID, because I think this is really important. You know, there's this new light and this new focus and this quote new norm on virtual care enablement, telehealth, remote patient. There's this new renewed focus, but 12 months ago, there were market drivers already pushing this at a very, very high level. The market drivers were value, quality, outcomes, performance-based care, right? And in order to succeed in that arena, it's mission critical to be able to engage with discrete data, right? So there would be a recommendation or a further demand to digitize, modernize, and automate. So let's not forget that value-based care was really pushing virtual remote adoption 12 months ago. Let's not disregard the fact that consumerism was leaking in very quickly as well. There was this thirst for a more modern, automated, again, digitized experience as to the liking of what patients or people today are getting with banking and hospitality and airline and social, right? I mean, this is, so we had two dynamics. And then what occurred is COVID comes washing over like a massive storm. And then we started to talk about, hey, where are we with distance care, safety, convenience, access? So really the stars are aligning, but I wanted to kind of give light to the fact that this is not a new evolution of care. This is where the puck was sliding, is sliding, and is permanently going, which tees up my first question, Samson, to you. As you kind of look at your experience as a CEO and a discipline of taking health tech to market in the formation of RPM for chronic disease management, where is virtual care today for you? What have you seen during the COVID-19 experience? What excites you, and what continues to solidify the fact that this is going to be a standard in care delivery?
Yeah, thanks, Rich, and really appreciate the sentiment about that. This is nothing new. I think COVID has forced the hand of, hey, we can't ignore that this is going to be and is now the future of healthcare delivery, not only in the U.S. but now internationally. Every single organization that we've spoken with, ranging from small 3 to 5 physician groups all the way up to top 10 health systems at the CEO level, has made remote care a top priority for the organization. When you look at the statistics right now and you see elective surgeries are in essence, non-existent and 10 or 20% of what they were the past, and that won't change for at least another 12 to 15 months. Routine patient care in person is again around the same 20 to 30% of what it was pre-COVID. And you really don't have many options other than incorporating telehealth or remote patient monitoring into standards of care. And that's what we're seeing being prioritized across the board, from everything from post-acute discharge patients and surgery settings to chronic condition management. And the adoption, both from the providers, the administration, and most importantly, the patient, is here to stay. It's the stickiness that we've seen. I think there was a stat that was an 8,000% increase in telehealth visits in just in the the first couple of months when COVID hit. And the analogy I always like giving is that all of these providers and patients are now, and you said it, Rich, are having that Netflix experience. And why is anyone going to go back to the Blockbuster experience? And to me, that's the most exciting, that we're showing that, hey, this is real, and it's increasing access to care. It's keeping people safe, and it's helping healthcare organizations provide the right care to the right patient at the right time while they're in the comfort of their home. And once you see that value working, it's a beautiful thing to see it all come together. And so we only see that expanding, and we're just getting started here. I truly believe that.
What's it look like, Samson? And then Jamie, I'm going to ask you to really dovetail into what you've been seeing as you've been consulting with providers and health systems and health tech on virtual care services, because that's a whole different angle. But Samson, when you're involved in your organization in the sales cycle and you see folks kind of sitting back a little bit, maybe like waiting on reimbursement or just not fully invested, what do you really want to tell them? I mean, I know in your heart, you're sitting there going, gosh, I see the tea leaves, you're not really seeing them, but what about that person or that organization that might be lacking in an investment strategy around virtual care services?
Yeah, that's a great question. And I'll use the adjective fear. I think there's a lot of people that are scared to jump into feet first. And it's unfortunate because I do think that this is a new game right now. And whenever you have a new game, there's going to be winners and losers. And unfortunately, the ones that are on the outside looking in and not making those appropriate investments today are going to be on, in an unfortunate circumstance from a business perspective next year. I think that what we're seeing right now are the ones that are investing are finding that the patient adoption and stickiness is there. The providers are recognizing that yes, it is a new way of delivering care, and there is going to be behavioral change in the way that providers actually deliver care from a clinical workflow perspective. But this is the beauty of innovation, and these are not things to pause on. These are things to work through and collaborate with organizations like HealthSnap or any other company that's going to help you digitize and provide virtual care at scale. And to me, that's something that I think the sentiment needs to be very clear, is that this is being done, and it's just a matter of working with the appropriate partners to provide the solution that's right for your organization.
Absolutely. Jamie, I was thinking through kind of, Samson's perspective. How do you take a perspective of where virtual care is, has been, and is going from a regulatory policy kind of reimbursement perspective? Because you live that every day, and people come to you and say, look, we've got to establish our virtual care digital strategy. They might be kind of teetering. Where do you put that solidification in front of them, and what are you seeing from a Capitol Hill perspective?
Yeah, it's interesting. I have a little bit of a different take, because I do believe that when we were talking about, telehealth, virtual care, remote patient monitoring, a lot of these things aren't new per se in terms of concept, in terms of technical capabilities, in terms of a service that you can provide through your healthcare office. But what is new is that in this year, in the pressure cooker of COVID-19, it caused a habitual change, right? So it went from maybe some of the most active telehealth offerings being around, not ever over a double digit of 10% of an office's services, to pretty much 90% or more, right? What happens there is that you have folks, as Samson said, completely rethinking the element that has really stopped telehealth from growing before COVID, which is redesigning and getting used to a new type of workflow that really truly allows the habit of telehealth and virtual care. And then out of that comes, as you provide those services, a lot of data in terms of what works and what doesn't work, the efficacy data that then really leads to what should be cemented in regulations and policy, and how we should do things at a individual office level to a national level, and what's really going to affect outcomes. And so that's been really exciting to see. I think there's going to be still a lot to learn, because right now, this year, we moved from providing most of our care in brick and mortar to all of a sudden going to virtual care. And then there's going to be this evolution looking at the efficacy data to figure out, what services can very effectively, cost effectively, and outcomes based effectively be delivered through telehealth, through virtual care. What are the other types of virtual offerings, such as remote patient monitoring, other types of chronic care management, transitional care management, that need to be coming into this mix to really help us get to the patient outcomes that we want to see. And we're already seeing this in some of the proposed regulations that CMS just put out. So there's a lot of things happening. A lot of things happened this year, a lot of things happening next year. It's a lot of stuff for both tech companies, for providers, for health organizations to really watch and keep on top of.
Speaking of that, I did remember you Jamie, talking about the movement of legislation over the past 6 to 8 months. Kind of give a perspective of pre-COVID and during COVID in terms of legislation and movement. And then I'd like your comments on, that fear that someone might say the regulatory loosening might tighten up again and we might not be able to get reimbursed in the future for these services. So give us some sense around the speed at which legislation's moved, how fixed do you feel it is, and for those that fear it might be retracted, kind of what's your thoughts on that?
Yeah, so as a former regulator, both having worked on Capitol Hill as well as in the federal agencies, regulation and the creation of national policy, it's a long time coming, and for good reason, because policymakers don't want to put something permanently in regulations that then need to be overturned the next year. And so unless there's a situation like COVID where there is not a choice and we have to do what we have to do, usually we see regulations move incremental changes over a decade. And what we saw this year with telehealth, considering the changes and the policy additions, the reimbursement additions that we saw to RPM, to telehealth provisions over the last maybe 5 years or so, what happened this year was something that would probably happen over a span of over a decade, happening in a matter of 30 days, which really turned the world around for anybody providing healthcare. And also really put, I'm sure, Samson, I want to throw this back to you, put the feet to the fire of folks that are creating, tech-based solutions to really have those solutions available and meeting the needs of the providers. And Samson, tell me I'm interested to hear what was that first 30 days like for you?
Yeah, we really had to put on our, I guess I'll say our consultative hat on, like, very hard, and really just put ourselves in the shoes of what you just said, that organizations right now are looking at just trying to understand, let alone implement, what it all means and how to even just get started. And incorporating and really focusing on our ability to be the trusted subject matter expert forced our hand as an innovator in the space to understand the federal registry, the Medicare, fee schedule, to a T, and actually become students of the game on the compliance side. And I was going to mention one of the early hires we had, back in HealthSnap was a director of compliance and regulation. And we made a very concerted effort to incorporate that into every single part of our company's design, whether it was our sales conversations and calls, or to our product and down to the feature and the way things flowed and looked, to align with compliance. And so being that trusted subject matter expert was a challenge for me to instill across every single employee of our company, that we need to be that expert, because the physicians and the healthcare organizations, they're dealing with an acute scenario here that we can't control. And so we really had to help them get through that initial hurdle, and just, I would say, unravel it for them and make something very complex and a moving target just simple, and continue to ensure that we keep it simple as the regulations change, which we are heavily focused on right now, especially as we look into the November final ruling with things like remote patient monitoring. So being that trusted subject matter expert was a high priority for our organization from the beginning.
Hey, Jamie, I want to dovetail in a question to you on that.
Yeah.
HealthSnap equals regulatory leadership mindset. Okay.
Yeah.
I think there's a little bit of what I'd say few and far between in that category. Conversely, what are you seeing in the health tech market and as providers or providers are purchasing, how suspect is that sometimes that, they're not aligned to a HealthSnap type regulatory leadership mindset, because there's a lot of health tech out there. What is your philosophy on that type of arena of question?
Yeah, no, I have to commend HealthSnap in terms of, the decisions that you made early on to really have a hand in understanding regulation and understanding those pieces. It allowed you to become a market leader when some of these changes came into play. And to really understand what was going on and capitalize on some of those opportunities in terms of really being able to provide your clients really important capabilities to keep their practices going and viable. And kudos to you guys for that. In terms of health tech in general, I have seen over and over again the numbers equating to 80% to 90% sometimes even of fail rates for startups. Because what's happening from our point of view is we have some really smart minds coming from the tech sphere trying to understand the health market and understanding that they have the capability of creating some sort of technological solution or tech-based service, which is accurate. And they create something that really feeds into a need around a specialty or a general need in the health market. But often we're finding that they then don't go as far as understanding how these services and solutions will then be tied into the general and large reimbursement landscape that then allows them to reach that sustainability. And so then you're seeing those failure rates. And let me just say, one of those things that are really important to understand is reimbursement is not just a bunch of codes, right? It's understanding the intent and the web-like framework of all the different pieces that go into the regulatory landscape that's created by multiple different federal agencies, then working with state agencies in terms of how they really feel healthcare should be delivered safely and effectively, both based on what they want to see in terms of outcomes and data from what's happening on the ground. And so to really take advantage of those federal and state-based regulatory opportunities, it's really important to understand that intent and understand where the puck is going. And I think that unfortunately, we haven't always seen health tech just across the board on top of that as much as we would like. And believe me, as former regulators coming with the intent of really seeing patient outcomes improve, we're really cheering for each company. We're really cheering for their sustainability. And so what we're doing is we're really coming alongside a lot of these folks to help them not just understand what is in the current regulations, but understand how to be influencers and leaders in terms of what is going to come out in the future. So as Samson said, there is a proposed rule now in terms of what's coming out of CMS's physician fee schedule regulation that comes out every year in November. And around summertime every year, CMS puts out the proposed rule for the healthcare market and industry to look at what they're planning on doing and asking for comments, which the comment period is now open till October 5th. And this year they're really looking to figure out what they're going to keep and what they're not going to keep in terms of the changes they made earlier this year around virtual care. And so it's really important to be part of that process so that what your offerings are going to be then matches what's going to come out in future regulations. And that just just kind of repetitive of what I said earlier in terms of not being reactive, but being proactive in terms of understanding and being a player at the table in terms of what our nation is going to require in the healthcare market.
Jamie, do you see health tech vendors investing enough in expertise and guidance from organizations like yourself, or without sponsoring yourself, but I know personally I've seen a lot of vendors that kind of say, I'd rather apply budget here than there. What's the travesty in that these days?
Yeah, no, again, I would love to see more companies follow HealthSnap's example of making sure that there are experts in-house to help you with all the different decisions in terms of, what's going on in terms of the regulatory front. I would also really love to see, and take this with a grain of salt, because of course it may sound like us promoting ourselves, but really we created Elevation because we saw a need. And what the need that we saw was that folks didn't understand the intent of what was going on in terms of emerging regulations. They didn't understand when regulations came out, there were a lot of questions on why is it this way. And we want folks who are creating health tech to be in a position where they don't have to ask the question of why was a regulation written this way, because way before the regulations came out, they were involved in creating it. And so we really want to see where tech companies are coming alongside organizations like us. We've created ourselves to have on hand the folks at the national level that are creating the regulations, influencing the regulations, former regulatory authors who have just finished writing regulations. The way that they're able to talk through the current and emerging regulations is at an echelon that allows the company to understand and forecast where they should be in a few years' time in a way that allows them to be a market leader like no other. And so really, it's really important to have folks in-house, as well as continuously tapping experts that are in the game right now and bringing that expertise to your boardroom, making decisions on where your company is going to go. And if it's providers, working with organizations, associations, or companies like HealthSnap that are really understanding what's happening in not just right now, but what's going to happen next year, what's going to happen in the year from now. How should we be creating our workflow in our offices to really match what it's going to look like and what we're going to have to do in the next couple of years down the road as well.
Samson, do you think in your prospect base, when you think on a scale of 1 to 10, 10 being a high level of education, 1 being a low level of education, do you think that the providers and health systems are very captive and aware of what's going on with compliance and regulation and reimbursement? Or do you feel as if you've got to do a lot of educating there?
From a compliance side and regulation side, I'll say that we are educating typically from the ground up, which is great. I think that's on us as a vendor, like I said, to have that expertise and be that trusted partner. I think from a clinical perspective, though, the value is certainly clear. I mean, I talk to physician leaders almost every day, and the feedback across the board is why wouldn't we do this? And that's exciting to me. They understand the clinical value of being able to potentially reduce readmissions, improve outcomes and quality metrics. And, Jamie, this kind of goes in line with the actual intention of incorporating a program like remote patient monitoring or new regulations like e-visits and transitional care management and CCM, they all go hand in hand. The intention is to improve patient outcomes, reduce readmissions, improve quality metrics across the board, and value-based arrangements. And we go into these conversations understanding where or working with the groups to understand where the needs are, from both a clinical perspective, a population health perspective, and a use case of the actual patients, of where they need the most support. And so I do think from a regulation perspective, we are working ground up here, but the awareness around the clinical value is certainly there. And again, I think that's the more exciting piece to me.
Absolutely. Jamie, any comment on that?
No, I can't agree more. When you really understand where the North Star is and working towards that versus understanding what your reimbursement requirements are, say, I want to bill against this code, so I have to do X, Y, and Z, is very kind of awkward compared to understanding that, nationally, we need to get patients to have these kind of outcomes. And then you're naturally almost doing what's going to come out in future regulations naturally. And these, as the regulations come out, you'll find that these are the folks that are going to be the leaders. These are the folks that are going to have the larger shares of the market.
And I can add to that too, Rich. Just in terms of like this year, what we saw trend-wise post-COVID is that, we are a startup. We're growing quickly, fortunately, and with that comes a growing market. And this is probably one of the fastest growing markets I think we could possibly imagine is virtual care right now. Unfortunately, though, a lot of companies started popping up in the last 6 to 8 months, and it's something we use internally, but it's true. They chase codes. And Jamie, that's to your point of a lot of companies, they see the shiny, there's reimbursement here now and blah, blah, blah. And they really don't fully understand why these codes exist. And more importantly, how to operationalize them at scale. And so they end up chasing the codes, and they end up diluting a lot of what the value is of why these codes exist in the first place. And unfortunately, it creates a lot of confusion in the marketplace. So we've had cases where we've talked to organizations. They said, this company said this, this, and this, and this one said this. Like, what's the deal? What's actually true? What can we actually do now? And then, by the way, it's going to all change potentially next year. So how do we get ahead of that? And it creates some hesitation, I'll say, to jump in. And going back to my original point of finding that trusted partner, it's really important, a challenge both from the vendor side and from the partner side as well.
Samson, what is a current high performing HealthSnap partnership looks like today? I mean, if you look at, some of your case testimonies, your anchor clients, bring some vision to the table in terms of what a high performing partnership looks like and how they're executing on outcomes.
Yeah, absolutely. I think this starts at the top, at the organizational level. There needs to be an executive sponsor at the health system level, I'll say, whether that's a chief population health officer or a COO or even the CEO in some cases we've worked with in these partnerships. We found the most success in, and this goes into where healthcare is moving from a revenue perspective for these organizations, is in the groups that have value-based arrangements already in place. And whether that's a fully capitated ACO or a Medicare shared savings program, those groups are highly incentivized to invest in virtual care tools or remote patient monitoring for chronic condition management that are designed to provide proactive care and reduce costs of care and increase access all at the same time. That is the holy grail, and where we see that just perfect alignment between the patient benefiting, the providers benefiting, the organization benefiting, the payers spending less money, and us being able to support that across the board, that alignment. So that's where we're finding the most success. These organizations that have a value-based arrangement, and maybe in addition to a fee-for-service side that might be transitioning to more value-based arrangements over time. And we see that trend continuing to sit where I truly believe that virtual care, again, whether it's remote monitoring or telehealth, helping facilitate that transition from fee-for-service to value-based arrangements. And it's on us as both the vendor and the healthcare organization to prove to payers, whether it's Medicare or commercial, that there is an economic outcome here, because unfortunately that's what drives at the end of the day is a cost savings. And in order for it to be reimbursed the right way or alignment the right way, there's going to have to be proof of that, and that's what we work very closely with our partners on at the get-go.
I don't want to be derogatory in this question, and I want to surface up in the most elegant way that I can. But the big box EHRs, coming to market, full-bodied, presenting same or like value propositions in remote patient monitoring, virtual care. What's the market look like, and what's the value of a young, spirited entrepreneurial company coming in and helping them manage those outcomes, versus their current legacy vendor per se?
Yeah, my perspective on this is that this is not a simple on-off switch. You don't just have the tool and expect it to work across the board. This is a lot more complicated than that in care delivery. Something that we do uniquely is wrap services around our technology. I think we touched on this earlier, but a lot of the organizations that we're working with, they have to restructure and realign their organization around virtual care now. And their hand is being forced to do that. And it's not a simple, again, I buy technology and all of a sudden it works. They need support from a resource perspective. And something that we do uniquely is ensure that patients stay compliant on behalf of the organizations that prescribe the program to us. And so the more that we can help facilitate on our end, the easier it will be for an organization to not only get started with a solution for remote patient monitoring, but most importantly to scale it and make it sustainable, both from a cost perspective and a resource perspective on their end. And so from that perspective, we have nothing, I would say it's against the big box EHRs. I think it's extremely complementary. We integrate with the Epics and the Cerners of the world because the health systems have invested a significant amount of money into those tools and systems, and we understand that. And so we align around the EHR and their clinical workflows. And so a part of what we do is make sure that we're incorporating our program within existing workflows, whether it's through Epic or Cerner or Athena Health or something on the ambulatory side. And so I think it's complementary. I don't see them moving so quickly into care management, but they're certainly starting to take a look at it. It can't be ignored right now.
Yeah. No, I appreciate that. And which brings me up to a question for really both you or Jamie. As you look at growth and you look at market, where do you see some of the top clinical use cases for virtual care and the regulations? Where is the market going in terms of the future of tech-based health and emerging regulations? Jamie, you want to take a stab at that?
Yeah, I think a lot of it is moving towards, as Samson had alluded to earlier too, is chronic care management, right? Whether that is, more on the side of whether it's skilled nursing facilities or home health. I think those are some really exciting areas to watch. We're trying to have folks have health and healthier outcomes in the places that they want to have their health care provided. And people are looking for life quality, right? Rather than just living longer, right? So it's really about being able to provide efficacy in health delivery in the location that the patient desires. And so I think that's really the future of healthcare, and home health is an area that I'm really excited to see. Samson, you want to talk a little bit about, I don't know whether you guys are working in that sphere, but I'd be interested to know what you guys are doing there.
Sure. Yeah, and there are health systems that have home health divisions that we do work within. So it's certainly, again, top of mind. They're looking for ways to meet patients where they're at right now. Rich, to your original question, though, we use a phrase all the time, and my background is in exercise physiology and nutrition, so this is an area that I certainly love and am very passionate about. But we always say that you don't catch heart disease in a day or two; you catch heart disease in 20 or 30 years. And if you think about how standard care is right now, we treat heart disease acutely when it happens over the course of not days, weeks, or even months, but over the course of years and decades. And that's the value, I think, of being able to capture data that's ongoing, that's always on, that's designed to fill the gaps between, uh, in our brick and mortar visits, so that you're informed of what's going on with an individual's condition, whether it's deteriorating or improving based on your existing care plan. And so there's a misalignment right now between, I think, our routine care delivery when it comes to chronic condition management, and where the value of telehealth and remote patient monitoring certainly changes the alignment towards the way it's supposed to be, which is ongoing and proactive. I also think, and Jamie, you can add to this, but it looks like CMS is starting to eye more acute scenarios for remote patient monitoring, and actually changing some of the regulations around days of data requirements for certain, maybe like, I think they proposed 8 days instead of 16 for maybe a post-discharge for an ACL surgery or a heart failure patient, and trying to incorporate programs that are designed for, an acute scenario as opposed to an ongoing chronic one. So I certainly see the acute market expanding over the next 12 to 15 months, in addition to the chronic condition management.
Yeah, I would agree. They did decrease the amount of time and what they're really saying, and this is going to be based on data that they're looking at, is that the sooner that you engage with the patient, the better the outcome is. The sooner you engage with the patient, the more engaged the patient themselves are, and then you get the patient to have better outcomes. Absolutely.
Hey, let me dovetail into that. We've talked about virtual care holistically, the technology. We've talked about regulation and policy and alignment. We've talked about reimbursement. We talked a little bit on clinical application, but let's talk about the patient. And maybe, Samson, that's the end all be all, the engagement of the patient. What has been the experience with HealthSnap in delivering your solution and having successful patient engagement and outcomes? Let's take a look at the patient and the benefits, maybe even some of the barriers of adoption. What are you finding and what are you seeing?
Yeah, not to sound crass, but I think the phrase we use internally is stupid simple. Unfortunately, with it's a predominantly Medicare population, but it needs to be just very simple and as turnkey as possible. Something that we've invested in is making the devices work right out of the box. And so when you're trying to onboard, let's say, an 85-year-old individual who may not have a smartphone or is just using one for the first time, or maybe it doesn't have Wi-Fi connection, the actual technology that's being provided needs to just work. And if you're relying on a patient to go through a login or a password creation or reset, it creates a lot of challenges on the onset, which then trickles back to the provider, and it creates this cycle. And so we really try to get ahead of making sure that the patients have the best possible experience. And we do that through a high tech and high touch model, where the technology is very simple, it's easy to use, but we also have real humans on HealthSnap's team, as I mentioned, that will outreach to patients and actually provide that human touch to ensure that they're staying compliant, that they have their questions answered, they understand the value, not just at the onset, but ongoing. And we continue to reinforce that over the duration of their program, which could be 6, 9, or 12 months based on the prescription we receive. And then tying in the care team on the other end is so important. So making sure that communication between their care team is ongoing, the benefits and the value of why they were prescribed in the first place. Just like if I told you, I'm prescribing you a blood pressure medication, you would say okay, and you take it, and that's a common modality. I think remote patient monitoring should be viewed the same way, or virtual care should be viewed the same way, where I'm prescribing you a program and you're taking your blood pressure at home just like you would take your medication at home. And I think that's where this is all moving towards right now. The simpler you can make it and the more alignment you can create between the care team, the technology, and the patient, the better off you're going to be.
Jamie, any ideas of when we talk about the patient and regulation and policy and outcomes, what you're seeing on Capitol Hill as we evolve patient engagement, patient involvement in care?
Yeah, even more so than Capitol Hill, I think in the federal circles, I've been really excited to see that in the previous decade, it was almost like push here, turn here, patient, you do this. And it's, with consumerism coming in, it's been really exciting to see people step back and say, each individual, each person, these patients are people. These are individual persons, just like me. I might be a patient at some point. And in order to effectively engage with that person, in that person's life, it's important to understand that person's health story, their individual story. And so that's really coming into play a lot more in terms of policy, technical requirements, and you'll hear that conversation a lot in the conversation around social determinants of health, which is such a key conversation that has been burgeoning for a while, but really hitting the streets now in terms of what's going on with the patient, what's going on in their life that is allowing them or not allowing them to be adherent to what their providers are asking them to do. And if you don't understand that, it's very hard to get to the outcomes that you want to see happen. And so there's a lot of activity around that that's going to be exciting to watch, because once we start building into our systems and into our psyche the ability to look at this, collect data on this, understand this, I think we'll understand the various different populations of patients and how to be effective in delivering care to various different people in different circumstances, which I think is so key in a country like the US, where we've got so many different populations, so many different cultures, so many different types of individuals that need tailored care.
Jamie, I'm going to ask if you would kindly kind of put a wrap kind of on your passions and your enthusiasm for today's conversation. I know you personally are very enthusiastic about regulations, being proactive versus reactive. I know you are a big proponent of being aware and educated and involved. What else, if you kind of part your words on this audience, is kind of on your heart about virtual care, the next 12, 24, 36 months, and why to stay attentive and focused, and how you help these organizations?
Yeah, so we really work with health tech companies, and their clients are providers. So I guess my takeaway that I would be messaging is to the health tech community, and that is that it's really, really important to not just understand regulations, but be involved in the process of creating the next emerging versions of regulatory landscape that are clearly, if you're working in the health sector, is clearly going to affect your business, your market. It's your market, right? And so it's important to understand that in order to be a market leader, even if your solutions are technically the state of the art, if it's not connected to the regulatory framework and the reimbursement framework, which is constantly evolving, then it's very hard to stay ahead in the market. And to understand that being aligned with regulations is not just about compliance, but it's about unlocking the opportunities that are tied to the way the market is structured from the regulatory point of view. And when you're thinking about health tech, there's a number of verticals that are really important to stay involved in. And that is, if you're collecting, exchanging, or providing access to any type of data, if you are working with provider organizations, then it's really important to understand data interoperability compliance. It's very important to understand both the opportunities, current barriers, and changing those barriers around reimbursement. And definitely, last but definitely not least, is understanding how then the FDA comes into place and how your products then fall under different definitions for medical devices. Those are all really important in order to be a steadily reimbursable value add to a provider.
This is certainly an exciting conversation to have, and everything you said really emulates kind of the thought process and the modalities of HealthSnap. Samson, I know you have a thirst, to align with highly invested leaders, folks that value proven technology, and then that combined interest, to serve the patient at a very patient-centric level. But what's kind of your parting words, on the audience that is kind of looking at this mid-year review of virtual health, virtual care, and what do you kind of want to lay out there as kind of your parting words?
Sure, sure. And I don't want to sound like the Grim Reaper here, but there was a New York Times article, I think it was, that showed that over 90% of patients that passed away, unfortunately, from COVID were living with at least one chronic condition. There's new studies coming out about risk factors for obesity and COVID-related, COVID-related infection. The patients living with chronic conditions, which unfortunately right now is over 50% of Americans are living with at least one, are the highest risk patients. And they're not receiving routine care right now. So while everyone right now is really focused in on the acute effects of COVID, obviously, there's unfortunately this underlying lack of care for patients that might be pre-diabetic or pre-hypertensive or pre-obese that are now going to be becoming obese and diabetic and hypertensive at a much faster rate than was already happening. My takeaway would be that when we're thinking about routine chronic condition management right now, from a provider organization's perspective, I truly believe, and we're seeing right now, that remote care is the new delivery method, and operationalizing around that is going to be the difference between the healthcare organization of the future and the one that unfortunately goes to the wayside. And that to me right now is the most exciting, where we're able to prove that, and to Jamie's point of using data to show that, and aligning with the regulation, and why these codes were created in the first place, and finding the forward-thinking partners and the early adopters that are not only doing it but proving the patient outcomes on the other end. And we're honored and excited to be able to support that cause. And like I said, I think we're just getting started here. I think there's a lot of growth, and this is a complete transformation in patient care in the United States right now.
Hey, well said, Samson. As the top of the hour approaches, I wanted to say again, humbled to serve the hour, and to serve what I would say is a pretty high level, complex conversation, but it's as true as it gets. And on behalf of the three of us, we'd love to see this content circulate into the right people's hands as you evaluate virtual care, remote patient monitoring programs and service lines. This was exactly what was needed in terms of kind of the virtual care state of the union, what's going on with regulation, and what's going on with clinical applications. So from me to you, Jamie and Samson, it's been a privilege. I hope we can do it again soon. Thank you also to Sunny for arranging this. And again, let's make sure this circulates and gets in the right people's hands. Thank you all.
Thank you so much, Rich. It's a pleasure.
Yep. Thanks, Jamie.